Welcome to today's AVITH in Context webinar. I'm Carolyn, Senior Project Officer at the Centre for Excellence in Child and Family Welfare, the peak body for child and family services in Victoria and Tasmania. I'll begin by acknowledging country and recognise that we are all joining in today from Aboriginal land. The centre is based on Wurundjeri land. Sovereignty was never ceded. This land was taken. We respect the resilience of the Aboriginal and Torres Strait Islander community in the face of this trauma and respect their right to an aspiration for self-determination and empowerment. We acknowledge the Aboriginal and Torres Strait Islander people as the rightful custodians and pay respect to any First Nations colleagues joining us today. The topic of the session today is young people's experiences and use of violence in the home. And for those joining today, I'm sure many of you are aware from earlier research that it is likely that young people who are using violence have more than likely previously experienced family violence, usually at the hands of an adult perpetrator. Our presenters today, Silke, Meyer and María Atiénzar-Prieto, were part of a team that has really honed into the types of child maltreatment, including child-experienced family violence, and what impact those experiences might have for children and young people. And for anyone who has already read this latest piece of research that has been published, you'll know there's a lot of detail and nuance to these findings. So for me, it's always good to hear people verbally talk through some of the research findings, hence the session that we're hosting today. So I will now formally introduce our presenters. We have Professor Silke Meyer, who is the Lenine Ford Chair in Child and Family Research and a Professor of Social Work at Griffith University. She's a criminologist and social worker by training, bringing practical and theoretical expertise to her research, teaching and writing. María Atiénzar-Prieto is a PhD candidate, also at Griffith University, researching the nature and perceptions of technology-facilitated coercive control in intimate partner relationships among adolescents and emerging adults. So two very well-versed and influential researchers who are able to share some insights for us today.
Thank you, everyone. Thank you, Carolyn, for the introduction. I also want to acknowledge our colleague, Kate Fitzgibbon, who would have loved to be here with us today, who worked on this latest analysis of the broader ANROWS-funded study, but Kate's enjoying annual leave and can't be here with us. So we'll share the presentation. I'll provide a little bit of a background overview and then hand over to Maria about the study design and some of the quantitative findings in the latest paper. And then I'll talk about some of the qualitative impacts from the broader study and some of the implications. And as Carolyn said, please note any kind of questions, comments in the chat. We'll have plenty of time for questions and discussions at the end of this. Before I continue, I also want to acknowledge the traditional owners of the various lands from where everybody is joining us today. For me, that's the Yagra and the Turrbal people in Meanjin, Brisbane, and recognize that this land always has been, always will be Aboriginal land. So just for a bit of background or the overview of today. So the specific focus is on multiple different types of child maltreatment experiences, including verbal and emotional abuse, physical abuse, sexual abuse, and experiences, childhood experiences of domestic and family violence between adult family members, so parents or carers. In children's lives. And we'll have a bit of a look at some of the qualitative impacts. They're not in this latest paper. They're part of the wider study that young people who've, particularly with experiences of violence in the home, but to some extent also with their own use of violence in the home, the impacts young people articulated and the support needs and expectations young people articulated. I want to start by, and I think by now we have a much broader recognition of this. When we started the original ANROWS-funded study, we had probably only just seen the beginning of the conversations and the framing of children as victim survivors in their own right, which then made its way into the current federal level priority policy around domestic and family violence, a national plan to end violence against women and children 2022 to 2032. But really recognizing, and I think this was part of what we specifically honed into with the latest paper, recognizing childhood experiences of domestic and family violence as a form of maltreatment, recognizing children who grow up with domestic and family violence in the home, even if they're never the direct target of any of the abusive behaviors that may be directed at the primary adult victim, that those constitute victimization experiences, and that those experiences do not require being physically in the same room. They do not require any physical harm to the child living in the household. We know from an extensive body of research internationally as well as, nationally by now, that children witness or experience domestic and family violence in various ways, including where parents often think they've shielded children from the experiences by making sure they're not in the same room, they're not in the home at the particular time domestic and family violence may escalate, but children experience the impact on other family members, the level of fear that affects household dynamics. Children often experience the aftermath of damage to the home in terms of property damage and or injuries suffered by the adult victim survivor, for example. In particular for the latest paper and the focus on child maltreatment, when we did the, the initial literature review for it, it really stood out that there's a large body of work and has been probably for the last couple of decades now identifying adverse childhood experiences and their short and long-term impacts on children. And some of that work, particularly some of that more recent work, acknowledges experiences of domestic and family violence as a form of those ACEs, but very often these are examined, as one adverse childhood experience, multiple and cumulative impacts without necessarily examining the specific role or impact of or intersection of particular forms of adverse childhood experiences. And I think the other thing that we've had very limited evidence, like I think in the Australian context, the ANROWS-funded study certainly was the first study that looked at some of the adverse childhood experiences and the intergenerational transmission of violence based on young people's self-reported use of adolescent violence in the home. So we've had the privilege and the opportunity, thanks to the contribution of young people's voices, to really look at that, how that intergenerational use of violence may play out for young people with childhood experiences of violence in the home. So as we've mentioned, the data for this latest paper has come out of the National Survey of Young People in Australia around adolescent use of violence in the home. It was an ANROWS-funded study. And I want to acknowledge, in addition to Kate, who's worked with us on the latest paper as well, the other colleagues at the time, the Monash-based colleagues, and also Dr. Hayley Boxall from the Australian Institute of Criminology. And I really want to acknowledge the participants, so the victim survivor voices of young people who participated in the survey, and who, I think to a great extent, we had a lot of quantitative measures, but we also had a lot of open-ended questions for young people to contextualize their experiences, make sense of their use of violence, and so forth. So really recognize the willingness and the contribution young people with lived experience of violence in the home or using violence in the home made to this research, and that without those voices, this research wouldn't have been possible. I'll hand over to Maria for the research design.
Thank you, Silke, for providing the background of this research. So regarding the design of this study, this included a national survey of 5,021 young Australians aged between 16 and 20 years old. And participants answered a range of different closed and open-ended questions about socio-demographic information, their current living arrangements, and their experiences of first, violence that they had witnessed between other family members. And that's what we refer to here as childhood experiences of domestic violence between other family members that were not directly targeted at the young person. Survey respondents were also asked about experiences directly targeted at them, including being subjected to direct forms of abuse perpetrated by other family members, and the direct maltreatment experiences we examined in this study included physical abuse, verbal and or emotional abuse, and sexual abuse. And young people were also asked about their use of violence against other family members, including physical and verbal and or emotional abuse. Now, questions about young people's experiences and use of violence also include follow-up questions, assessing the nature of these experiences, including the relationship with the perpetrator or victim survivor and the frequency of these experiences. In the analysis, we only included childhood experiences of domestic violence between parents or carers, along with experiences of child maltreatment by a parent or a carer, with the exception of child sexual abuse experiences, which were included regardless of the identity of the perpetrator, given the significant impacts that this form of abuse has on later life outcomes, irrespective of the victim offender relationship. So this, for example, could include abuse perpetrated by a sibling. Importantly, to also avoid overestimating the prevalence of child maltreatment in our sample and capture a pattern of abuse, experiences of physical abuse, verbal and or emotional abuse, and childhood experiences of domestic violence were only included in the analysis where the young person reported frequent experiences of these types of maltreatment. So this is at least on a monthly basis. However, again, experiences of sexual abuse were included in the analysis regardless of the frequency of the behaviors, also due to the detrimental impacts of this form of abuse, even if they only happen once. And lastly, survey respondents were also asked to provide detailed information about the impacts of their experiences of domestic and family violence, their help-seeking and support needs. Silke? Thank you. So regarding the sample characteristics, 67% of the participants were assigned female at birth, 33% were assigned male at birth, 4% identified as gender diverse or questioning, 31% identified with a diverse sexual orientation, 5% were First Nations young people, 10% had a non-English speaking background, and around a third, 36% reported at least one disability. And then the majority of the participants, 83% of young people lived in a major city, 15% in a regional area, and 2% in a remote area. So regarding the experiences of regular maltreatment, and again, this refers to occurrences taking place at least on a monthly basis with exception of child sexual abuse. Results show that approximately 2% of the sample reported experiences of child sexual abuse. Around 6% reported experiencing regular physical abuse. 17% of the sample reported having experienced regular verbal and or emotional abuse. And lastly, the most reported type of child maltreatment in the sample was childhood experiences of domestic violence, with nearly a third of the sample, around 27%, reporting experience of domestic violence between parents or carers. Now, the high prevalence of verbal and or emotional abuse in childhood experiences of domestic violence identified here in the study is particularly concerning when considered alongside with other Australian evidence. This shows that non-physical abuse is the second largest contributor to health risk behaviors, including self-harm, suicidal behaviors, and harmful substance use. Now, we also explored multi-type abuse experiences, and while around 30% of young people reported experiencing only one type of maltreatment, nearly 1 in 6, so around 11.5% of the respondents reported experience 2 types of maltreatment. Approximately 5% reported three types of maltreatment, and around 1% of the sample reported experience all 4 types of maltreatment. Now, when looking at the intersection between childhood experiences of domestic violence and other forms of maltreatment, the findings indicated that occurrences of domestic violence in the home did often not happen in isolation, but they were strongly associated with other forms of child maltreatment. So, for example, young people reporting frequent childhood experiences of domestic violence were 5.5 times more likely to also experience regular physical abuse, and nearly 30 times more likely to experience regular emotional and or verbal abuse. Now, these findings highlight the significant overlap of different forms of child maltreatment experiences, especially with childhood experiences of domestic violence, significantly increasing the risk of children and young people also experiencing regular physical and verbal and or emotional abuse directed at them or vice versa. Now, regarding young people's self-reported use of violence, those who reported experiencing regular physical abuse were 1.5 times more likely to use adolescent violence in the home as a pattern of behaviors. And also in our sample, young people reporting experiences of regular emotional abuse were 5.5 times more likely to use also violence at home as a pattern of behavior. And lastly, young people reporting regular experiences of domestic violence in the home were also 5.5 times more likely to use violence against a parent or carer as a pattern of behavior. And now these findings highlight the significant impact of child maltreatment, especially of non-physical forms of abuse, on the use of violence of these young people. Now, some participants' characteristics were also found to be associated with an increased risk of child maltreatment experiences and use of violence. For example, young people living with a disability were more likely to report both using violence in the home and also were at a higher risk of all maltreatment experiences, including also multi-type abuse experiences. And then gender and sexual identity were also associated with experiencing child maltreatment. As cisgender females and LGBTIQ+ young people were more likely to experience all forms of maltreatment when compared to cisgender heterosexual boys.
All right, couldn't find the mute button. Thanks, Maria. Okay, we'll move from those findings into some of the qualitative articulations of young people, specifically around the impacts they've noticed or described in the open-ended feedback of the survey. Starting with social and emotional impacts, and I suspect none of this will really come as a surprise to anybody. In many ways, these findings resemble what we've known from the adult evidence base around adult victim survivors affected by domestic and family violence for a long time, in terms of the mental health impacts, in terms of self-esteem, in terms of social isolation, in terms of harmful substance use as a coping mechanism. So young people talked about all of these things, including crippling depression, anxiety, post-traumatic stress disorder, coping strategies, suicidality. So a range of things that were quite familiar with or quite well documented in the context of adult experiences of domestic and family violence, for example. We also asked young people whether they felt their experiences of violence in the home had cultural impacts, particularly in the context of cultural disconnection. And what was really interesting, I think, particularly for young people who identified as culturally and linguistically diverse young people, that young people to some extent associated their parents' culture or their parents' religion with their parenting behaviors and their use of violence, or their use of violence by one parent towards the other in the context of intimate partner violence. And that as a result, young people describe distancing themselves from their cultural or religious communities or identities, which I guess is particularly concerning when we think about that cultural identity and cultural connectedness in so much of the criminological work that we have, the sociological work that we have, is repeatedly identified as a protective factor. So cultural identity, cultural connectedness as a protective factor to mitigate risks of poor mental health outcomes and other life outcomes, for example. So I think this raises implications for how we work with, particularly with young people from culturally and linguistically diverse backgrounds who may be experiencing and or using violence in the home, and how we work in a culturally sensitive and meaningful way where culture doesn't become stigmatized as associated with the experiences of violence in the home, because that breaks down some of the protective mechanisms that culture can have. We also asked young people about any perceived impacts on school performance. And again, none of this really comes as a surprise. I think we've known from the broader ACEs research and evidence base, without necessarily untangling any of the different experiences of adverse childhood experiences, that ACEs are associated with an increased risk of a range of poor life outcomes, including when it comes to education. So increases the risk of educational disengagement, increases the risk of engaging in what may be labeled as problem behaviors in school, in terms of behavior, in terms of lack of attention, in terms of ability to focus, and as a result, keep school performance at a satisfying level. So young people talked about how it affected their ability to concentrate, that it had an impact on the learning they missed out on, that eventually some of them disengaged, whether it was partly attributable to their behavior that they carried into the school environment, or because they were unable to cope in the learning environment. I think one of the things really important to recognize here is that young people in this study, and we know this from other studies, is that school very often is a safe place for young people who experience violence in the home. And that young people with victimization experiences in the home want to be at school because school offers structure, school offers respite for a period of time. But the challenges around the unaddressed trauma experiences in the home makes it incredibly hard to perform in the school environment as it is expected of young people, which then leads to stigma, shame, and the risk of disengagement. So just to wrap up, and then we've got a fair bit of time for questions and discussion, but really, I think what a lot of the findings out of the broader ANROWS study, and again, of the specific analysis we did for the latest paper, the importance of recognizing children as victim survivors in their own right, with their own unique support and recovery needs. And that needs to go all the way from some of the more recognized forms of maltreatment in terms of their impact, such as sexual violence and physical abuse, to the non-physical forms of victimization experiences, including verbal and emotional abuse experiences and experiences of domestic and family violence between parents or adult carers in the home. And I think, as Carolyn noted at the very first beginning, from a number of different resources and webinars that you may have accessed over time, that I think we've had that the call for trauma-informed responses in the child and family welfare space, youth services space, including youth justice space at the more extreme end, child and youth mental health space, educational settings, recognizing that when we have young people who come to the attention for their use of violence in the home, there's an incredibly high likelihood that they have childhood experiences of violence in the home, including a very high likelihood that those childhood experiences involve domestic and family violence between other family members. And I think the reality for many of those young people, that those experiences aren't just there somewhere, possibly historically, but that the trauma those experiences have caused have often been left unaddressed. I think it really highlights the implications for how we think about our responses, particularly when it comes to non-physical types of abuse, whether that's emotional abuse and neglect, or whether that's domestic and family violence in the home, where I think we've gotten really good at addressing the parent level interventions and providing parent level support, disrupting the immediate risk of harm or potential immediate risk of harm to children by responding to parents, whether that's through parent-centered support mechanisms, or whether that's through removal of an adult perpetrator from the home, or removal of the adult victim survivor and children into temporary crisis accommodation or safe housing, for example. And then we still struggle with the availability and accessibility of child-centered recovery support mechanisms that really meet the unique needs of children and young people, that are not automatically addressed just because we've started working with or responding to parents or holding the parent causing harm accountable in the family context. I think the other findings, as Maria has highlighted earlier, from this specific sub-analysis, is the importance of the early detection of non-physical forms of victimization experiences of children and young people in the home, including childhood experiences of DV, but also emotional and verbal abuse experiences directed at children and young people. Because I think, again, we still have a very strong focus on physical harm and a physical incident model when we're talking about child maltreatment. And I think a range of practitioners, particularly beyond the child and family welfare space, are quite comfortable recognizing and responding to, whether we're talking healthcare settings or educational settings, for example, to physical harm or risk of physical harm, and not necessarily able to recognize the full extent of non-physical forms of harm and the impact it has, particularly when we look at this data in terms of the intergenerational transmission of violence in the home. And I think the other implication around particularly the findings around young people living with a disability, but also the other diverse populations that we've talked about, whether that's culturally and linguistically diverse children and young people in the more qualitative findings, or whether that's LGBTIQ plus young people, in terms of the elevated risk of reporting use of violence in the home. But when we start looking at their childhood experiences of trauma, also the significantly increased risk of experiencing different or multiple types of child maltreatment. I think the other opportunity that's there in terms of focusing on early detection and responses to children as victim survivors, childhood experiences of domestic and family violence, other forms of maltreatment, and child-centered recovery needs really have that benefit, not only the specific intergenerational transmission of violence disruption that we looked at with this specific study, but also from the more qualitative sense and from the wider research evidence that we have, for example, from the Australian child maltreatment study around mental health outcomes, but also broader evidence around criminological work around childhood experiences of trauma and the increased risk of early onset and persistent youth offending, for example. We really have an opportunity by responding more trauma-informed and more child-centered early on when we're working with families where domestic and family violence is identified and or other forms of maltreatment are identified, to disrupt a number of those adverse short and long-term outcomes, from educational disengagement to poor mental health outcomes and risk of suicidality, to youth offending, youth homelessness, and poor coping mechanisms in form of harmful substance use, for example. Thank you very much. I'll stop sharing.
Thank you very much, Silke and Maria, for going through what was probably for you a very rushed combination of a lot of detail and a lot of facts and figures there. And I would encourage people to go and read the extended form of that research if you do have time. One of the questions I was actually going to jump in with earlier, someone had asked about how do you actually define physical abuse? Was there a working definition that you used for this research, and how did you go about capturing that?
So for all the different categories, overarching categories, all in the whether it was observed between so exposure to domestic violence, experiences of harm, and use of harmful behavior, all use the same kind of measures, similar to what the personal safety survey uses. So multiple measures identified as physically abusive behaviors, verbally and emotionally abusive behaviors, sexually abusive behavior. So it wasn't just a question about, have you experienced physical abuse or physical harm? So it uses those multiple questions. And with this specific question, so, does slapping children's palms count for physical abuse? It would, in the survey, because the survey participants would have been asked whether they've ever been slapped, hit, so without making any, direction or judgment about whether that was slapped in the face or slapped on the back or slapped on the hand, but about the action of being slapped or being hit or being pushed or being punched. So, I think similar, if people are familiar with, and I'm happy to share the link to so the full ANROWS reports have the full instruments in them. So happy to share the link with you, Carolyn, afterwards, and you can circulate it to attendees if
yep, definitely. Yep, it'll be good to send those around. There was a number of questions and as well as comments, both in this Q&A section as well as when people registered. A number of people had comments along the lines of keeping the child and child's voice in view of our work is so important. So we are ensuring the best interests of the child at all times.
And maybe can I say, if there's a question about the implications in the education setting, and I think we get this a lot. I think this, not just this latest paper, but the adolescent use of violence study has probably been our most presented study in all the work that I've done. And I think Kate would probably say the same, in the last 15 years. And the uptake from education has probably been the most limited. So if there are education people on the webinar today and you're interested in a presentation of either these findings or the broader ANROWS findings, we're very happy. We've presented to some schools that were specifically interested. We've shared the information with education departments, but very happy to do presentations to different state and territory departments or specific school communities if that is of use or interest, because we're quite happy to disseminate this as far and wide as possible and wherever it is useful.
Yeah, thank you. Such an important service sector to tap into when it comes to children and young people.
Yes, and I think I think from the conversations with teachers, when I come across teachers at different kind of forums or symposiums, I think there's increasing recognition and I think the desire among teachers and teaching staff to do better in that, that recognition responses, but also the reality of under-resourced educational settings. And I think similar to, I see that there's another comment from a nurse navigator, I think similar to what we've seen in the nursing or hospital space for a long time. I think that frontline practitioners recognize the need to do something and would like to do better, but without the national kind of support and training and information provision. People often feel, before I ask the wrong questions or before I open up a conversation that I then don't know where to refer people to or how to link people in with other community supports, I better don't say anything or don't ask any questions. So I think it's also for us, and I think particularly from a university perspective in general for the tertiary education sector, more onus on the sector to ensure that domestic and family violence forms a core component and not just an optional guest lecture or a half-day workshop for a number of disciplines beyond social work, for example. So I think education, tertiary education to become an educator would really benefit from having a core component around domestic and family violence.
There was a question specifically asking, many of the youth support services work with people from 10 to 18 or 10 to 24 perhaps. Is 10 too late to kind of have therapeutic impact on adverse childhood experiences?
I think it's never too late. And I think, we have neuroscience evidence now that if children and young people have access to trauma recovery support, a lot of those early experiences and the impacts are not necessarily irreversible. I think the challenge is that very often children and young people, even throughout adolescence, don't necessarily have that access to child-centered recovery support. I do want to say, though, about that age, we did in the larger study ask young people when they started to use violence in the home. And if they remembered, and not everybody necessarily remembered, but I think we had about 2/3 who answered that question. And out of that, around 40% of the young people said they were younger than 10 years old. So, I think it's not too late, but I think the reality is that intergenerational transmission of displaying aggression, poor self-regulation, and so forth often starts before 10. And so ideally, we're not waiting until somebody then becomes visible to various systems as a teenager who displays aggressive behavior in their, whether that's in the home or their school settings or similar. Can I just quickly, Ainsley, your comment about the question, what help did young people seek or not? It's probably too big a question to answer here. I'm happy for you to contact me. The second ANROWS report fully covers help seeking, support needs, and experiences. And there's a lot of qualitative information in there. It's quite mixed. Like, I think some young people had really good things to say about their disclosures. A lot of young people also had a lot of negative things to say. And I think the key things that probably came out of the help-seeking piece is similar to what we know from adult victim survivors. Very basic expectations. They wanted to be listened to. They wanted to be taken seriously. They wanted a person they could trust and disclose things without that necessarily being discussed with their parents. So I think similar to what we know from adult victim survivors in terms of, having a voice, being taken seriously, someone who actively listens and who actively inquires about someone's well-being.
Thank you. Someone's just suggested, can we please do another webinar around what young people are saying about help seeking? Yep, I think that's a great idea. Absolutely. There's a question there about data on gender.
Sorry, I'm just trying.
Are you trying to find
the comment? Is it just a general question of
so did you collect data on gender in the intergenerational transmission of violence?
Yes, and there's some gender breakdown in the larger ANROWS report. In this latest paper, we looked at gender, so victimization experiences were gendered. And I'm going to say maybe Maria knows this better.
So yeah, we included gender, so like sex assigned at birth, female as a binary variable, female and male, and also gender identity in the analysis. And they were not predictors of use of violence when controlling for the child maltreatment experiences. So yeah,
that's right. Now it's coming back to me, and I think
more closely linked to the type of the maltreatment.
Yeah.
Yeah. Yes. Okay. Yeah. And I think this paper showed this more clearly because of the types of analysis we drilled down to. Because in the ANROWS report, where we looked at gender and use of violence in the analysis where we didn't control for childhood experiences, gender was so LGBTIQ plus young people were more likely to report use of violence in the home. Similar for the disability status. So disability was associated, if you just look at factors associated with use of violence, disability and gender identity and sexual orientation were all associated with a higher likelihood of reporting use of violence in the home. When we then looked at their childhood experiences, all these cohorts were also significantly more likely to have disproportionately experienced childhood experiences of DV and or other forms of maltreatment, which is why we then moved on to this paper to kind of bring that together in an analysis and control for childhood experiences of victimization alongside those other factors predicting use of violence in the home. Because I think it's important to recognize that if you just look at it at the characteristics and use of violence in the home, the takeaway message may be that gender diverse, sexual orientation, and young people living with a disability are more likely to use violence in the home. But once you control for their victimization experiences, it's actually their victimization experiences that predicts a higher risk of use of violence in the home, not their other individual characteristics.
Mm-hmm.
It's all in the detail, I think is what you're saying. Yep.
Yes.
Okay. It's not just young people who use violence who are going to need support and therapeutic intervention. I think, my mind is thinking that there must be some way to provide almost like a universal kind of response. As soon as we know that children have been in a home where, these different types of maltreatment have occurred, there needs to be some sort of response in an ideal world, regardless of what presentations they're showing at that time. A couple of people have put in their questions about how will we receive trauma-informed training about what to do and what to say. And I think that goes a long way in and of itself to get people who are already doing the work coming into contact with children and young people to be on the lookout and to feel comfortable to ask those difficult questions and follow up with their conversations. I'm keeping an eye on the time, but I'm also aware we do still have, there's quite a number of questions we haven't been able to attend to, but potentially we can liaise with Silke and Maria after this session and see if there's anything that jumps out to them that they would like to respond to, which we could then send out in the minutes. And there's a couple of other comments and links, other services people have made suggestions about, such as Victims Assistance Program, child and young persons representatives on the VSAC committee who could offer insightful input to this work. So we'll see if there's a way we can share those resources around.
Can I quickly, there's just
of course.
Comment to a comment about or a question on how can practitioners support parents from diverse backgrounds where normalized parenting by physical or emotional strategies. When the ANROWS report gets shared around, the culturally and linguistically diverse young people in those questions around what would you like to see or what might be useful for other young people in your situation. One of the key themes that came out from young people's suggestions was education, awareness raising, more of a whole of community approach around, parenting, disciplining, what's okay, what's not okay, because I think young people talked about not really realizing that what they experienced was abuse, because they said, well, how was I to know? That's how I grew up, and that's how people in my parents' culture discipline children, for example. So I think there was a two-tiered suggestion coming from young people of they wanted more information and education for themselves to understand what's okay and what's not okay, what's abusive behaviors, to kind of validate that if you're experiencing something that is abusive and unsafe, there are also support mechanisms out there. But equally, they articulated they wanted more education and awareness raising for parents and communities of migrant backgrounds or refugee backgrounds in particular, where that kind of use of violence was normalized as a parenting strategy.
I've got a couple of slides I just wanted to share just with some promos of next webinars, but I would firstly like to sincerely thank Silke and Maria for their time and pulling together a very succinct summary of what is quite a lot of information to get through. So thank you to you both. I'm sure everyone would join me in saying that it's incredibly interesting, and I think we need to continue to hold hope. I think some of the findings are quite bleak. Some of these statistics are could leave us feeling quite downhearted, but we need to hold hope that we do, as you said, Silke, we do have a chance to provide therapeutic support and turn things around for children and young people. We just need to know how to do that in the most targeted and effective way. So we will continue to have further conversations down the track, hopefully, as well. Quick shout out about our upcoming webinar next week on the topic of reframing young person violence through a neuroaffirmative lens. And a short survey, if I can get people to please just take 2 minutes to complete our survey, letting us know a couple of things that you've learnt from this webinar, as well as new topics that you would like to hear more about. Thank you so much to everyone who tuned in today. A huge thank you and shout out to our presenters, and we'll see you at the next AVITH in Context session.